Hey class, I want to talk a little bit today about Tanana Valley Clinic and an accident that happened there where 6,000 gallons of water spilled throughout the building, which initiated their business continuity plan. This happened in January 2018 on the 23rd. Um, and so I want to talk a little bit about where they started and how this issue was resolved because of their plan, and finally how they ended. So business continuity plan starts with planning. And so that means organizing a team. It means defining the scope of the problem that they need to solve. And it means testing the plan. And then once the plan has been developed and tested, it needs to be updated. And so TVC continually updates their plan as they're required to by something called JCO, or a Joint Commission of Healthcare Facilities, who inspects them. And so luckily for them, they are held to a high enough standard where their plan was able to work for them well, and really led them through the emergency. So um, the second phase of any plan is crisis recognition, and that happened through the Fairbanks Fire Department, which identified there was a bunch of water coming out of the ceiling when they were alerted because the fire suppression system lost power, which is a health and safety issue for any hospital. And so they came over, identified the water was leaking everywhere. They covered medical equipment very quickly, computers, and then they went and shut off power and water supply to the building. The building beforehand had been evacuated before the fire department came in, and this happened after work. And so during the evacuation process, the fire department is prioritizing health and safety and taking care of anyone who might be impacted. But that's really what the organization led with moving forward past the crisis recognition and into containment, where the fire department turned over responsibility to 30 staff under a facility manager and the general management of the hospital, or the healthcare clinic. So that crisis containment happened throughout the night of the 23rd, and ended at 8 a.m. when the business was able to reopen. And so I'll talk a little bit about what went on during that time, and then ongoing afterwards. So while they were able to get up and running within 8 hours, the actual recovery took 2 months. So after containment comes managing a recovery, and that was broken down into two simultaneous efforts, delegated to two different groups of folks. And so the first was a health and safety task force, and that really focused on how construction and working near construction and having water spilled throughout a building impacts folks. And it started with education, and so educating the employees about what they would be exposed to during recovery. Those things included air quality monitoring and mold assessments and monitoring by local contractors. And then it also involves equipment testing and other environmental testing and asbestos abatement. And so the key was to make sure everyone knew what they were exposed to and how they could self-mitigate any risks that they were exposed to. And so the second part of the plan was an operational and logistics task force that had to bring the facility into a state that it could service patients. And so that really involved contractors, subcontracting quick work, and so that involved repairing damaged equipment, drywall, ceilings, exposing electrical wires, and obviously getting in there with an ampemeter and making sure everything is running. And it involved but removal of carpets. The fire department was able to suction up a great amount of water, but a lot of the building was flooded too. Alongside that, non-essential staff and medical professionals were moved to Fairbanks Memorial Hospital, their partner, and then moved to other parts of the building, to alternative sites. And in some cases, some staff were just sharing offices during the recovery. So those are all things people did to prioritize the safety of the people working there, but also data and information storage was critical. So HIPAA requires that medical records are required to be safe, so they can't go onto a cloud, or they can't go into networks that have easier access, or vulnerable to less security. So that was stabilized immediately also. And so I think the big takeaway, aside from all of the tasks and the constant communication, was that for an accident that caused 2 months of recovery time, they were able to, by 8 a.m. the next morning, bring the facility into an operable state that met a certificate of occupancy requirement and a safety requirement, and that took a very small fraction of the total amount of the recovery. For a facility that sees 50,000 people a year and has cash flow of $50 million, you can safely say that for an accident that without a business continuity plan could have taken 3 to 5 days to recover, they were able to save $400,000 to $700,000 a year and prevent the stress that comes with of having a canceled appointment, or not getting your prescription on time, or whatever the inconvenience may be, or health risk that may be for not seeing a physician when you expect to. A lot of folks in Alaska are rural and come into TVC, to get care. So it can be really inconvenient. I think throughout this, learning about this, I really thought about the resolution phase of business continuity, and so I think one thing I was impressed by was TVC's ability to keep facts, keep people gathering facts regularly, and to communicate over and over and over again, and to document the actions, not to duplicate work, and so I think those 3 things, along with practicing general project management techniques, helped TVC really utilize their business plan to a great value. It wasn't just something that was sitting on a shelf. It was something that the organization had high buy-in from leaders in the organization, and it was owned and understood well within the group. So it wasn't confusing. Terminology was defined. People knew who they had to call. So again, I think this is a good example, or one example, of a business continuity plan working, and keeping an organization moving, and not letting a business disruption paralyze an organization, or throw it off track. So thanks. I look forward to watching everyone else's presentations, and yeah.